Hello, I'm Dr. Leonard Karadimas, orthopedic shoulder surgeon in Port Huron, Michigan at Advanced Orthopedics, and I'm going to show you one of my all arthroscopic shoulder surgeries, including an all arthroscopic rotator cuff repair. This is a view. Now we do this through small little poke holes and a small camera. And this is actually a view looking underneath the top bone in your shoulder called the acromion. That's where very often you can have some spurs that develop. And those spurs can be painful and actually cause some damage to the rotator cuff tendon, damage including ultimately tearing it. So what I'm doing here is I've actually removed the spur for the most part. I'm working on kind of cleaning it up here. But I've removed the spur, and this is a little burr. This is how we do it. It's a small little Dremel instrument that we poke through the poke hole, and it actually, at the same time it sort of Dremels off the bone, it sucks all the fragmented bone or debris out. And I want to basically go in there and remove the spur and kind of create a clean undersurface there. Where that little burr was pointing to, right there, is actually the end of your clavicle, the end of your collarbone. And often you can develop some spurring at the end of your collarbone as well, secondary to arthritis mainly. So what I'm doing here is basically using this small little burr, removing the small little spurs off the undersurface of the distal clavicle, the end of your collarbone there. We want to take all the spurs out. We want to make sure we have a nice space in there. So once in this particular patient, he has a pretty good sized rotator cuff tear. I'm going to fix that, but once we fix it, we don't want it to re-tear. Now you can see between those two bones, there's a space there, and that's fairly arthritic. So what I'm going to do is I'm going to take about 5 millimeters of bone off the end of the clavicle, the end of the collarbone. Where the collarbone attaches to the acromion, the acromioclavicular or AC joint, if that becomes arthritic, which is the case in this gentleman, that can be a generator of pain. So while I'm in the shoulder, basically I'm going to fix all the problems that I run into. So once the patient, even though the patient's main symptoms may be rotator cuff, when I'm in there, I am fixing everything. That way there's no problems down the road. So you can see there, I've removed about 5 millimeters off the end of the clavicle or collarbone. There's a nice space now between the collarbone and the acromion, and that is a acromioclavicular joint resection arthroplasty is what that's called. So now we're looking at the actual rotator cuff tear. The tissue I'm pulling up there is actually the rotator cuff tendon. That's torn. You should not be able to pull that up and look at it. That should actually be attached to the bone, and that is a pretty good size rotator cuff tear we're looking at right there. So what you want to do, obviously once that tendon is torn and is torn off the bone, what you want to do is kind of clean up a little area of bone, get it nice and clean, because what we want to do is actually reattach the tendon back to the bone. So you want to have a clean surface of bone once you reattach it that the tendon will heal onto. It is possible to reattach the tendon back to bone, and we're going to show you in a moment here how we do that. So we're kind of cleaning it up here. You're starting to see it maybe a little bit better. That's a shaver. I'm just cleaning things up, cleaning the edges of the rotator cuff. So you can see towards the bottom of the screen where you don't see a hole there. The tendon is attached to the bone. And towards the middle of the screen, which is more in front of the shoulder, you can see the tendon is attached to the bone. It's right on the left side or middle of the screen that you see that hole there. And that's the tendon. That's where it's torn. That should be attached to that pink area, which is the bone. Here's another look at it. You can see the torn tendon on the top from like the 10 o'clock to 2 o'clock position. That's the hole or the tear there. And you can see the bony surface now that I've created to reattach it to. This is a punch. How would you reattach a tendon to bone? And this is what we're going to show you right now, arthroscopically, mind you. Through the scope, we're working through small little poke holes in the shoulder now. No big incisions, little poke holes. So I'm gonna punch a hole in the bone, and the repair I'm going to do is called a double row repair. So this right here is an anchor. It's a small biocomposite screw. It's made out of a calcium phosphate material. So over time it'll just turn into bone. That is attached to a stitch, and that's how we do it. That's how we're going to reattach this tendon back down to bone arthroscopically. Double row speed bridge, we call it. And that's the screw you saw. The first screw I put in was what I would describe as my anterior screw, the one in the front. I'm also going to put one in the back. This is a good sized tear, so we're going to use multiple screws since it's a fairly large tear. Again, we want to create a pilot hole. And put our second of actual 4 screws we're going to use on this repair. It's called a swivel lock anchor, biocomposite. It'll just over time turn into bone. You can see how that we're able to secure stitches right down to the bone. Making sure the depth of the screw is where I want it there. That's what we're checking. We do want it to be fairly flush with the bone. Again, you know, if you've seen my other videos, we use different color stitches so I can do suture management. We have small little poke holes. Once those stitches are pulled out, I want to make sure I know which stitch is what. Now I'm getting good bites of rotator cuff tendon. It's called a scorpion suture passer. So you slide the stitch through the tendon, and if you have, I have a few poke holes here I'm working with, and then I shuttle the stitch through the tendon. So now you can see I have a screw in the bone, a stitch through the rotator cuff tendon. We're going to do the same one to this posterior back anchor I have. I take that back. First I'm going to put a small stitch in the front here. And if it's a big tear, very often I will use accessory sutures. I will pass multiple stitches in large rotator cuff tears to make sure that the whole thing is pulled down and compressed right along that bone wall. That's what you want. You want that tendon you want to bring that tendon over and really press it right down on the bone to reattach it. So here's my posterior shuttle stitch we're doing right now. Again, get it through the tendon. We're going to pull that stitch outside the shoulder. Where all my stitches are, if you were to see the outside of the shoulder, you'd see small little holes with a bunch of stitches sticking through them. And what we're going to do here is, again, we're going to shuttle those stitches, you see the blue ones, through the rotator cuff tendon. So we'll end up with multiple stitches all through the tendon, connected to the bone there. And then what you're going to see next is actually, so I create I put 2 more screws in laterally and pull the tendon down and reattach it. So what you're seeing here are a few different shots of the tendon compressed right down onto the bone, fully repaired. I'd call that a watertight seal. That is a all-inside arthroscopic rotator cuff repair. My name is Dr. Leonard Karadimas. I'm an orthopedic shoulder surgeon here in Port Huron, Michigan. Thank you.